There you go. Hi, Paul Slackers, Good News Broadcast, speaking to Dr. Jenny Van Amburg. Hi, doctor. How are you?
I'm well, and how are you?
Okay, good. Associate Clinical Professor for Pharmacy Practice at Northeastern University, Bouvet College. Okay. We're going to talk about unhealthy U.S. economy takes toll on Americans' health, okay? In essence, people have less money, possibly are spending less money on their health care?
Absolutely. Many patients are trying to find a way to save money, and by doing that, they're cutting back on medical care that could potentially put their health at an increased risk.
I would agree to that because, in essence, to keep my premiums down, I took a higher deductible. And so now I'm spending like $30 as a deductible where I used to spend $20. That alone makes me wonder what do I do? I'll be honest with you.
Yeah, and there was a national survey that was done by the American Heart Association recently that looked at what Americans are doing, and it found that 57% of them said the economy has affected their ability to take their health care, which is what you were just pertaining to, sort of, trying to save money in different ways. And 32% have made changes in the previous 6 months, such as delaying preventative care appointments, like going to their doctors for follow-up visits, as well as not taking medications to help save some money.
So that's concerning, isn't it?
It's very concerning, but as a result of this, we're actually beginning to see more and more people coming into the pharmacy to look at using over-the-counter medications to treat some of their health care problems.
Okay.
And so really what we're trying to do is get the message out there that, patients really need to speak to their pharmacist because they may have difficulty choosing the right medication based on diseases that they may have or medications that they're currently taking.
Yeah, I would imagine that would put a lot of responsibility on pharmacists at a point like nowadays.
It is, and we really open that. We want patients to come in and to be using our expertise as well-trained in medication use and side effects of medications, and we can really help patients to choose the appropriate medication therapies or even making suggestions in their prescription therapy to more cost-effective medications.
Now, the difference between an over-the-counter medicine and a prescription is, in essence, an approval by the government?
In essence, yes. It's what a prescription product can go and say that it's safe and effective for a patient to use on their own, and then it can become an over-the-counter product. But with that said, one of the things we really like to do is to encourage patients to speak to pharmacists to make sure that they're using it most effectively.
But an over-the-counter medication is probably approved as well, isn't it? Here with which Federal Trade Commission or what is it?
Yeah, the over-the-counter medications are approved in the same process that prescription medications are approved in.
So in essence, an over-the-counter medication probably can't be sold over-the-counter if it's not approved?
Well, there are some medications that are out there that are listed as, they're sold in the same area as over-the-counter medications, but they're more vitamins and supplements, and that's a whole different area that you go to.
Okay.
And, sort of going back to the take-home message here is patients really need to be speaking with their pharmacists who are well-trained in using over-the-counter medications, or they're well-trained in medications use in general, prescription and over-the-counter, and they can be a resource for when they're looking at other supplements, if you will, to use.
Mm-hmm. Okay. Well, what are some recommendations for over-the-counter products that you
patients, what we're seeing patients coming in are related to cold and allergy products and pain relief, and then we're also seeing an increase in patients coming in who are beginning to talk about some of the more uncomfortable issues like constipation. And so, depending on what the patient's coming in, I'll use constipation as my example, is that when a patient comes in and talks to me, I recommend a product that I'm very comfortable with in knowing that it's been clinically proven to relieve constipation.
Mm-hmm.
And I also look at that it's not going to cause any more side effects or interact with any other medications. So I recommend a product like Miralax.
Mm-hmm.
It's very easy for patients to use. It works, doesn't cause any additional side effects for them, and it doesn't really have any drug interactions with any of the medications that they may be taking.
Mm-hmm. Okay. That's good news. Are there some other kinds of over-the-counter things that you look into?
Well, other over-the-counter medications like that we use to treat cold or allergies, and a lot of what people be coming in pertaining to the flu season coming up and the H1N1, those require a little bit more investigation and consultation with a one-on-one with the patient. because there could be more drug interactions with some of those products that we'd be recommending to medications that they may already be on, whether it be a drug-drug interaction or maybe some of the medications they are taking have the same active ingredient in it that they would be using over the counter. So in that regard, you need to have a more in-depth conversation with your pharmacist to get the best recommendation.
Now, I've seen that some pharmacies are giving out flu shots now. Is that, did I see that correctly?
You did see that correctly, yes. So we're really trying to sort of help the public health initiative and sort of making sure that people are receiving in an accessible way those things that can help prevent further problems. So giving flu shots, for example, yes, pharmacists are giving flu shots as a preventative measure to hopefully prevent them from getting flu or decreasing the seriousness of the flu that they may get.
Now, that isn't the swine flu shot, though. Is that correct?
The swine flu or the H1N1 vaccine is currently not available yet, but it will be probably out this fall. And depending on, what state people are in and where they actually see their pharmacist, some states will be allowing their pharmacists to give the H1N1 vaccine.
Okay. Actually, here in New York, I think they started it today with the schools, but not with a nasal type of flu vaccination. Or no, with a nasal swine. Swine, was it today? Here in the city, a vaccine here, swine flu fear, creates a rush. I believe there's instead of taking a shot, there's another way you can inhale it? What is that?
For the influenza, that's a nasal vaccine that they can give. And again, based on the criteria of what patients have for chronic conditions, they need to be assessed of which one they can get, whether it be an injectable or a nasal. And so they need to have a conversation with their provider or their pharmacist, depending on where they're getting access to that vaccine.
Okay. And as a pharmacist, what's your thought in regard to the swine flu shot?
It's one of those things that I think it's part of the public health initiative to prevent other people from getting sick. And so, using vaccines appropriately can help to decrease, healthcare costs.
Okay. Jenny, thank you very much. We'll send some people over to some of these websites. Miralax one. I see something here with American Heart Association.
Yes.
Last question. What's good news for you?
Good news for me is when I know that my patients are actually speaking to their pharmacist to get the best information to make them a well-educated consumer of over-the-counter and prescription medication.
All right. Sounds good. Thank you very much. Take care.
You too.
Bye-bye.
Bye-bye.